morning, everybody. So welcome to the webinar. This is actually the first of something that I'd wanted to try a long time ago. We're going to do a literature review of a treatment of attention deficit hyperactivity disorder. It's overview of the evidence, whereby we were able to actually bridge the gap between research and clinical practice, but actually have the authors participate so that they can tell us kind of the story behind it. And why is the prevalence rate increasing? Is it due to better diagnoses or some of the different factors? So what do you think, Dr. Brown?
That's a good question, Karen. There are several reasons. I think it's the first thing that's important to note is that there's not an increase in the number of children with ADHD. There's an increase in the identification of children with ADHD. And there's several reasons for that. In part, it's due to recognition of the disorder and among professionals, among the lay public, among a number of people, teachers and educators. It's also due in part to a decrease in the stigma with regard to issues around mental health and getting mental health treatment, availability of insurance for mental health issues, and also in terms of changing some of the diagnostic classifications to recognize that ADHD is what we call in the professional literature frequently a comorbid disorder.
And the purpose of the paper was to develop evidence-based clinical practice guidelines, and that's still very valid.
And among pediatricians, who frequently are those individuals who very first identified the disorder, in terms of how to identify it, first of all, and second of all, how to manage it, and what the evidence is for that work. Now is we know that behavior management, behavioral interventions are very effective for these children, as well as medication.
I want to conclude by saying thank you guys for your attention. I hope that you found this valuable. We're actually going to be making this webinar available for free. I think that this is really great content that anybody can benefit from. And a lot of you guys here, I believe, are clinicians. So please feel free to share this with your peers and definitely the parents as well.